Hello, my name is Ricky Weissman, instructor of the DGSA. In this video, I will introduce you to the basics of manual trigger point therapy, also known as the Swiss approach, which are used since the early 90s. Manual trigger point therapy is often an excellent and effectful addition to dry needling because you can treat the facial structures more specific. Studies have shown that both methods are effective. Therefore, manual trigger point therapy can be used in patients who cannot tolerate dry needling or where it is contraindicated. Check the indications and contraindications. You will find a separate video for that. The Swiss approach consists of 4 manual techniques. Technique 1, trigger point compression. Technique 2, manual stretching of the taut band. Technique 3, myofascial release, and Technique 4, intramuscular mobilization. In this video, I will show you the Technique 1, which is trigger point compression, also known as ischemic compression on the upper trapezius muscle. The goals are to increase the local blood flow as a result to ischemic compression, as well as the stretching of the trigger point zone. At first, you have to identify a trigger point by palpation. To learn how to do that, check out the video tutorial about trigger point palpation. The palpation in Technique 1 can be applied in a pincer grip or in a flat grip. The flat grip can be used if the muscle is pre-stretched enough and if there are no structures underneath which must be protected from pressure. In this video, I will show you Technique 1 with a pincer grip. Here I feel the taut band. Now I look for the most sensitive spots within the taut band. Sensitive spots within the taut band are per definition trigger points. Active trigger points reproduce the patient's typical symptoms. In Technique 1, trigger point compression is combined with a small active assistive movement of the respective muscle. On the one hand, the movement distracts from pain, and on the other hand, it stretches the structures around the trigger point and increases the local ischemia. Maintain the pressure for about 20 seconds and repeat the procedure 2 to 3 times before you move to the next trigger point. Be aware to keep your pressure exactly on the trigger point. As the treatment is painful, the patient must be able to interrupt the treatment at any time. However, it is important to mention that the pain during the treatment should be felt as a good pain. Very often you feel an instant release of the taut band directly under your fingers, and the patient will experience instant pain relief. You will get the best result for Technique 1 if you follow these rules. Keep the pressure precisely on the trigger point. Adapt the pressure to the patient's tolerance, otherwise the patient will push you out of the trigger point zone with a strong contraction of the muscle. Often it is better to compress a little bit longer than harder. If you are treating myofascial pain, make sure that you always reproduce the typical pain with trigger point compression. Note that there is no rule to always use manual trigger point techniques 1 to 4 in the same order. For example, with sensitive patients, it can make perfect sense to start with Technique 3, which is a more gentle and broad facial technique. To complete your manual skills, check out the video tutorial for the other techniques of the Swiss approach. I'm Ricky Weissman. Thank you for watching, and don't forget to follow us on Facebook.